and it's all yours.
Okay. So, first of all, it's been lovely to join this group, and I hope you find this little talk about the Bowen Technique interesting. It's also felt like a good opportunity for you to maybe know a little bit more about me, but don't worry, not too much. So, before I start, I had wondered if any of you had had a Bowen treatment. So, if any of you can indicate if you have or haven't, that would be good. No. All right. So I thought I've done it in a few parts so that we can have any questions at the end of each section. So there are four parts to this. So I'm going to start with the man himself. Thomas Ambrose Bowen was born in Australia in 1916 and died in 1982. His parents were from Wolverhampton and emigrated to Australia. Tom left school at the age of 14, taking various labouring jobs before going into the building trade and working as a general hand at the Geelong cement works in Australia. His parents were keen Salvationists, and Tom Bowen himself ran a Salvation Army boys' club. He was profoundly deaf and had lost a leg through diabetes. And it was while he was working at the cement works that he just started treating people after work. Ultimately, it was going so successfully, he became full time. And at the time, he was seeing 13,000 people a year, of which 85% only needed one or two visits to resolve their condition. People travelled miles to see him. He also ran a clinic for years, treating disabled people for free. I'm going to read a quote written by Stephen Grellet, who was a missionary. And this was a quote that Tom Bowen reportedly liked and lived by and was a favourite saying in his clinic. I expect to pass through this world but once. Any good thing, therefore, that I do, or any kindness that I can show to any fellow creature, let me do it now. Let me not defer or neglect it, for I shall not pass this way again. This seemed to be his philosophy on life. There are so many myths and stories about how this technique came about. I'm almost reluctant to not pass on any of them. But there are four here that I've picked out. Firstly, it was styled based on osteopathic, chiropractic, craniosacral type principles, and whether he learned this through textbooks, from others, or intuitively, we just don't know. The second, which I think is quite an interesting one, was it was a technique learned in a Japanese prisoner of war camp. Another thing that pops up is, I like this one, deep and secret teachings from Aboriginal leaders. And the final one is it was a gift from God. There are others, but those are the four ones that you'll find if you look him up. In my mind, he had a unique ability to connect with people and developed a gentle touch, which he used in an intuitive way that produced amazing results. Those that were privy to watching him work had different interpretations. So, from the few that did observe his work, who were therapists of different sorts, different interpretations have evolved. So there are different schools of Bowen and different approaches to how they use it. However, the commonality of the various approaches include the type of move. You put your thumbs on the tissue, you take a little bit of skin slack, apply a little bit of pressure, and then you do a roll over the part that you're trying to treat. And then you repeat the same thing with fingers from the other side. And it's done in sequences of moves in different parts of the body. The next thing is the breaks between the moves. And it's the only treatment I've ever done where you leave the room, the patient thinks you've gone crazy, and you come back in a couple of minutes and you carry on. And it's a process that happens several times throughout the treatment. Final thing that is common to all of them is that you're treating over the whole body, which again is common in some of the complementary therapies, but not not in all. There are also treatment reactions, which are very common. And as a practitioner, it's really interesting that the same things come up again and again, which to me sort of validates what's going on. There's a feedback that you get, and you think, yeah, this is the same thing happening again. So things like headaches, shivers, flu-type symptoms, twitching, I've seen a bit of that, tiredness, changes in sleep, flare-ups of old injuries, which I can attest to. So the reactions can occur over a few days. So at this point, would anybody like to ask me any more about the start of this? If not, I will
The
continue.
the I'm going to throw one in. It's only
Yeah,
so the reactions
yeah,
that, because my first question was going to be, did he have any official training himself? But you went into that. So,
yeah.
but the treating reactions, is that the same kind of thing as when people talk about a healing crisis with certain? I
Well,
much prefer the term treatment reactions than healing crisis, because that sounds terrifying when people say that. But
I would say in my experience, they're mostly physical reactions.
okay, yeah. So not
Mm.
so much the
Although there is some, I have read around some people having emotional
okay,
reactions,
yeah,
but in my experience, it's been mainly physical. And yes, in what I've looked up, he had no formal training.
yeah. It just that has been discovered. That's like you
Yeah,
say, it could have,
yes,
but just yeah. Okay,
yeah.
cool. Thank you.
Right. So on to the next bit. How did I become a Bowen practitioner? By accident. I qualified as a physiotherapist in 1984 in Liverpool. And as part of career development, I attended many courses over the years. And the more techniques I learned, the more my curiosity grew relating to what works, what doesn't, and why. Having an academic approach to my career as a physio, at the same time, I've had a fascination relating to the connection of mind and body alongside my own spiritual interests. In particular, the quest to understand pain and explore approaches to help people presenting with problems that don't resolve over time or with other treatments has been an ongoing passion. I was very fortunate to be on one of the first courses run by another Australian, a guy called David Butler, who is a physiotherapist who's been a pivotal figure in the field of pain management since the mid 1980s. His work has certainly had a significant impact on the type of courses I took and the way my career developed. Around this time, I also learnt basic acupuncture techniques, and that further challenged my thoughts on what worked and why. So I was already having a foot in two camps by this stage. It was, however, in 1998, whilst working in a small, lovely local hospital in the Cotswolds, that I received a flyer regarding a course for a technique which claimed to help problems such as whiplash, back pain, shoulder problems, things that typically don't go away very easily. And I thought, ooh, that's interesting. But the timing wasn't great for the course, and yet for some reason I could not bin that flyer. I did, but I pulled it out of the bin again and felt like I was really being tapped on the shoulder. So I went to the course. Another quirk of fate occurred on my journey to the venue, which was beset with difficulties. I was held up in traffic, my exhaust fell off and had to be replaced en route, and I arrived very late. Um, it's the horrible moments when you walk into a room, everybody turns round and goes quiet and look at you, and you just want to dig a hole for yourself. Thankfully, there was a lovely lady sitting who beckoned me to go and sit with her. And Gilly and I have been friends ever since. By the second day of the course, I thought I was definitely in the wrong place and possibly on the wrong planet. This was no physiotherapy course. Whilst I happily slurped my coffee, I was surrounded by those drinking water, taking various remedies and supplements, alongside discussing esoteric subjects. Watching the technique being demonstrated, I just couldn't understand how these sequences of seemingly innocuous soft tissue moves could be used to treat people with apparently consistently good results. While everyone else was swapping partners, Gilly insisted on staying as my partner, as she realised in no uncertain terms I was a fish out of water. It was also obvious to the course tutor, Michael Nixon Livy, another Australian, that I had no idea what this course was about. And he asked in front of everyone, why was I there? So I explained about the flyer, and it transpired that no flyer had been sent to any hospital anywhere. And it remains a mystery. The technique, or his branch of it, is NST, the neurostructural integration technique, which is just another interpretation of the Bowen technique. On the back of this, he asked me to be a patient for the next demonstration of the technique. Everyone gathered around the plinth like hawks. I'm almost tempted to say like vultures, waiting for any response from me. Although nothing specific happened during the moves, I have to say I felt a little odd afterwards, but covered it up as best as I could. It wasn't until that night that I experienced symptoms from an injury from many years previously in my early teens. And so this technique was proving to be very interesting. I was inspired by people on the course, and in particular, my new friend Gilly, who was an experienced complementary therapist. I completed the course to become a practitioner, and after that, I trained through the College of Bowen Studies for the more traditional UK version, run by Julian Baker, who has worked tirelessly to teach and research Bowen and became a friend. In practice, the results were very positive. I was fortunate to have treatments myself from Gilly and Julian, and so could be objective about the technique from both sides of the coin. And I think for me, that was really important, considering my very down-to-earth approach in my normal physio job. I was fascinated. Any questions? Nope. Okay. So I've got a couple of case studies. I thought this would be a good way of giving you an idea of just how this technique can work in quite a remarkable way. The first comes from an article I wrote in 2004 for a newsletter with an unusual for the Association of Physiotherapists in Energy Medicine. Yes, there was such a thing. I got talked into that as well. A 56-year-old lady had been referred for physiotherapy treatment with a very unusual presentation. For quite some time, she had a feeling of weakness, mainly affecting her legs. Her balance was poor, a hip would give way, so she was falling a lot. She regularly sprained her ankles, and she felt the need to walk with a stick. She also suffered from back pain. She had aching in her hips, thighs, knees, and ankles. The symptoms had become worse over about 4 to 5 years, and she'd started getting a sensation of numbness on the bottom of her feet. So at that time, I was working in an NHS department, and I was able to offer her the treatment, and she accepted. The first 2 treatments were a week apart, and the third a couple of weeks later. She did have reactions to the treatment, which were headache, upset stomach, and some aching in her hip. The outcome: the hip hardly gave way anymore. There was a significant reduction in the amount of falls. The aching in her thighs had reduced. The knees and ankles didn't give her any problem at all, and she had improved energy. From her point of view, she was 80 to 90% improved. The sense of the numbness in the feet had also reduced, and her husband noticed that her balance was better, and she felt more confident as a result. At this stage, I did add some exercises to try and enhance the progress, and I reviewed her again 4 months later when she had continued with the exercises, and was also attending yoga classes. She'd had no falls, the hip no longer gave way, she had no pain, further reduction in the numbness in the feet, and improved balance. It's fair to say this is not a typical presentation that walked through a physiotherapy department door, and I don't think I'd treated anybody with quite such a presentation. I found the experience very interesting and rewarding, especially from an initial stance of what on earth am I going to do to help this lady? The second case study is much more recent. This gentleman has kindly given me permission to use his case study for this talk, and I'm going to call him Jay. In September 2020, he was travelling on his motorbike at 50 miles an hour when a car pulled out at a junction and knocked him off his motorbike, hitting him from the side. He was seriously injured and taken by air ambulance to the John Radcliffe Hospital in Oxford. He had extensive injuries. I don't think I've seen a list of as many fractures. He had multiple fractures and joint injuries of his arms and legs and needed lots of surgery over many months, and including some skin grafts and muscle grafts. Looking at his leg, he virtually didn't have skin on it. It's like an anatomy book, just looking at the muscles. I've actually known Jay since 1998. He's also a physiotherapist and was one of my managers in the NHS. He had come to me for help on and off over many years, and we've stayed in touch. And I treated him with Bowen previously. He came to me for help about 18 months after the accident, hoping that I could help him with some symptoms that he was struggling with. The first was a whole body sense, a wave of overwhelm. He felt he could cry and was unable to move. He mainly felt this over his chest and stomach area, and he would have to lay down for about 15 minutes to get this to ease, so that he could actually get up and function again. He was tired all the time, such that he was in bed by 9 o'clock each night. That's late for me, but for him, that was early. He had memory problems, in particular relating to recalling words and some speech problems, which could be slow at times. And he also walked and moved more slowly than his normal, which was very evident when he came into the room. Physically, his walking was limited to 30 minutes. He could stand for 10 minutes. He couldn't drive for long, and he had problems with things like stairs, getting up from sitting, kneeling, that kind of thing. So there was a lot to address, and we had no idea what Bowen would do. His first treatment was February 22, about 18 months after his accident. After the first treatment, he was much less tired. He'd only had to lay down once and had none of the whole body overwhelm sensation at all. He could now drive up to 2 hours without a problem. He was sleeping better and able to walk for an hour and had less pain. It was a significant shift. The second treatment was about a week later. He continued to be much better and felt that walking and stairs were almost normal, and he had a noticeable reduction in pain. I treated him a few times more, and on his sixth treatment in May, about 2 months later, the outcome was he was very active, not needing to lay down, only if he overexerted himself, and he felt much more normal. He could walk for an hour and kneel and get up without a problem. He could stand for 30 minutes rather than 10. Stairs were normal, and he was sleeping well. He had improved memory and ability to recall words, and he could do much more in terms of activity and didn't have as much pain. So it was pretty, we were both really happy that he was moving forward like this. I last saw Jay in January 2023. He'd had a bit of a setback, having had two more lots of surgery, but overall, he'd remained improved. I then relocated to Whitchurch, but I'm keeping my eye on him as I was fortunately able to transfer him to the infinitely more capable hands of Julian Baker, for which I'm very grateful. Any questions?
There you go. Couldn't unmute it. That's amazing. So do the N is it one of because the NHS, especially when it comes to alternative treatments and stuff, like are very kind of they won't commit to anything too much, I don't think. I mean, Reiki's just about beginning. I saw an NHS ad for a job for a Reiki practitioner the other week, which was amazing to see. So is Bowen Technique one of the ones they're more favourable of, or is it still a
No.
kind of dark art to the
Yeah, I was very fortunate that in the first case, I was working somewhere and I had liaised with the Chartered Society of Physiotherapy, and at that stage, I don't think it was too well known as far
hmm
as they were concerned. It was a soft tissue manual technique.
yeah,
I was operating within the parameters of my professional role.
yeah,
And in fact, I did, which I haven't got anymore because of GDPR. I did a little study myself on shoulder problems. I
yeah,
did my own little experiment in the research in the department. As time went on, no, I couldn't mix it.
yeah,
So when
yeah,
I saw Jay, because I mixed my NHS and self-employed work from 1998,
yeah,
then I was able to see him, and it was primarily where I worked as a Bowen practitioner and as a
right,
physiotherapist.
yeah,
So that would explain that. So sadly, no. One of the reasons that Julian tried to do some research, some of which was done with another physio I know, Michelle Marr, who's a lecturer at
hmm
Coventry. They tried to do some research to see if we could move it forward.
yeah,
But as you all know, research is a nightmare unless there's a lot of money and you
yeah,
have all the right conditions. It's really hard to get enough people and all the right things in place that actually the research would count for anything. And the research that he did when I worked with one of my supervisors and we looked at the research. There were so many areas where bias could have come into it and different things, and it just shows you. But I mean, he did. People have tried to do
yeah,
some
yeah,
stuff like that, and it's what's needed, but
yeah,
it's how to get it done. All complementary therapies have the same issue,
yeah, completely. Yeah,
which is a real shame.
yeah, yeah. Thank you.
So, how does it work? Well, how does any technique work? The bigger the carpet bag of techniques and knowledge I accumulated, I decided the less I knew. Tom Bowen used to say that when you do the first moves of a Bowen session, the body knows that the emergency is over. In some ways, I feel this is a pretty good summing up. It could be inhibiting the fight and flight sympathetic nervous system and then activating the parasympathetic nervous system, putting people into rest and repair. That would be a simplistic way of looking at it. So I asked Jay, do you think? He felt, having been through all of the pain experience that he had, the oversensitivity by then of the nervous system affecting the pain mechanisms that he had been calmed down. And in his most recent treatment, he literally felt a body-wide sense of relaxation, which again would sort of make you think maybe along those lines. Interestingly, I was looking up gentle touch in itself, which can, by various mechanisms, reduce stress, reduce pain, improve sleep, enhance immune function, accelerate healing. It can also reduce cortisol levels in stress conditions and increase oxytocin levels, which has various effects on the body, including a reduction in pain and effects on mental and physical health. Oxytocin It's also released during mindfulness meditation. So gentle touch could be a factor in how this technique works. So then I thought, okay, let's go to another tutor then. So I asked a friend of mine, what did he think? He said, depends who's asking. Laugh out loud. He said he thought it was a soft tissue therapy that triggers signaling to a particular part of the brain, which I can go into if you want. And this part of the brain is responsible for calibrating internal settings. So, in other words, regulating our homeostasis, our internal system. Part of the brain, and we'll go into it, is the insular cortex, and it deals with interoception. This is an internal sensory mechanism in which the physical and emotional state of the body of a person are consciously or unconsciously noticed, recognized, and responded to. It also deals with external input. So you've not only got it looking at what's going on inside, it's looking at what's coming at it. And where it's all thrown together, decisions are made on what needs to take place in relation to the information. So very much a feedback system. And again, when I'm thinking about the moves and the breaks, you've got this gentle touch, you've got the space and time. When you're out of the room, the patient can relax because you're not peering over them and doing things to them. So it does lend itself to having a feedback mechanism. And how many treatments do we know where there's actually a gap in what you do and you leave the patient for a bit and then come back to them? So part of that to me resonated when I listened to said friend. Uh, there's also the connective tissue system. It isn't just the nerves that are transporting all this stuff. Your soft tissues do it. Your fascia does it. Your muscles do it. And you can have communication both by chemicals and hormones, but also the lovely quantum physics. And I'm sure we've got some of that going on as well. I'm going to go back to David Butler, the Australian physio. He not too long ago wrote a blog in talking about his reflections on his career. And one of the things he said is that patients are ultimately all neurological, although at different extremes of the injury spectrum. So you could have somebody like Jay, who's got loads of physical injuries, and somebody who has Parkinson's disease. But at the end of the day, everything that you're doing is addressing the nervous system in some way or form. And as he said, for all therapists, we're all eventually going to meet at the brain. There's another quote from him, which I think is better in his words. Most manual therapists seek the magic technique, and there will always be magic moments in manual therapy. But the reality is that the rapid changes we may see probably occurred because the patient rapidly altered the way they think and feel about their problem. The technique, the way it's delivered and timed may have been the key to change. He goes on to say, what bugs me is that it took so long to realize that it was I, myself, who was probably the main variable in the outcome, not the techniques. He goes on to say, I'm not saying that massaging patients with a wet salmon will help. However, the interactional power needs better analysis and understanding. And I think he's spot on. So, from my perspective, I don't believe you can touch anyone, including animals, without influencing their nervous system. The minute you put your hands on a patient, you start to change things. In fact, change could be said to occur even at the stage when you're talking to them and interacting with their belief systems, allowing them to tell their story, what their expectations are, what are their experiences of previous treatments, what is their understanding, what's wrong with them, before you even start. Or did it start before they entered the room? I made the decision to seek help. What kind of help? And that's the problem. When you try and explain how treatment works, any treatment, there are so many factors involved. This is purely conjecture on my part as a physio and from my ponderings over the years. In my view, the moves do correlate to relevant areas of the nervous system that before I knew Bowen, I would have targeted anyway with the patients that came in with the conditions. So I found it fascinating to see where these moves were occurring and thinking, oh, yeah, that makes sense. I also, as long as I'm not too rusty, think it coincided with some acupuncture points as well. There's no doubt in my mind it's the nervous system is reacting to the moves and it results in change. But there is a lot going on. I have a final thought. I spent nearly 40 years in healthcare, and I'm very sad to leave it. All of it involved learning daily. There is one more conclusion I would like to put forward that's very hard to put into words. When I was treating people, I used to say as I put my physio hat on, and the only way that I can describe it is that I would be in a state of focused intention. And I felt that somehow this made a difference. Over to you, Rob Chapman.
That was ace. I really enjoyed that. I actually have a question as well, but it kind of hints on what you were just saying about you being in that focus, that headspace. And there was
Mm,
certainly some of the kind of things you were saying about kind of mindset, and that kind of resonates with some of the ideas and
yeah,
things in hypnosis, and how just reframing and changing someone's perspective and idea of what a possible outcome could be can have an influence. But what I was interested in as you were talking through all that is that when it comes to the effectiveness of the technique, that I guess there has to be an element of what you yourself as the therapist are bringing to that session.
mm,
Because I know, you can sit somebody down and quite easily give them the A to Z, step by step, of how to hypnotize them and make a difference.
mm.
But if all they do is that mechanically, robotically, they're never going to be as effective as if they take it on board and own it. So is that part of that?
I think what I felt was that I had a very strong belief in
Yeah,
anything I did,
yeah.
and I had clinical reason for it because I'm somebody who sort of tends to follow rules very carefully. You have to have clinical reasoning for what you're doing, and I used that even when I was using Bowen,
Yeah.
so that if anybody said, you've done me harm, I would be able to say exactly why I'd done what I had,
Hmm.
and where I had, and
Yeah.
for what reason,
Yeah.
and being mindful of, all of the history and making sure that you'd assess people thoroughly
Yeah.
and probably using my same physiotherapy assessment skills,
Hmm.
which always included very in-depth history, making sure that the people in front of me understood what I was going to do and why,
Hmm.
and understood more about their condition or how I would, see their condition. So I think there's a that's just popped into my head. When I worked at RAF Bryce Norton,
Hmm.
training, was treating the parachute training school. Their I can't remember the name for it. Knowledge spells fear is the sort of badge that they wear. It's the quote on it, and I really believe that when you're treating people, people need to understand
Yeah.
what you're saying to them. They want it in language that they can understand. They want to be able to ask questions, and they want to understand why you're doing what you're going to do. And to me, that was just an integral part and a very essential part of how I worked.
Yeah. And I guess there's also something then in that, because that's all in the background and that's all part of your approach and how you're coming to it. But of course, from the client perspective, they might not, they don't necessarily know why you're doing that, but on an unconscious level, that level of detail and care communicates then that
Well, I think
that
especially
level of care and can as well.
especially in latter years where things changed so much in the NHS.
Mm,
You know, a lot of people's frustration was you'd ask them why you're here. Well, my doctor sent me.
no,
It's not a good start. Uh, and you know, and they just thought you were going to give them a sheet of exercises, which nearly drove me bonkers.
yeah,
So you know, you're starting to unravel that and helping them understand that no, I'm here to help you. You
yeah.
know, let's find a way forward and do it in a very detailed way.
Mm, brilliant. Fabulous. I'm going to shout. Has anyone else got anything they want to question? Oh, look, Sally's got some questions too.
It's not a question.
Oh,
It relates to the book that I'm reading at the moment about kindness,
Mm.
and you were talking about oxytocin and cortisol and all that sort of thing, and they talk a lot in that book about both of those things, plus many more, and about how, you know, so if you're kind to your client, that that can increase those two chemicals which they need to get better.
It was interesting that
I don't.
David Butler even
Mm,
talked about that. He would say that even when you put your hand on a patient, you know, you might just touch your hand on their shoulder or something.
mm,
Uh, you're interacting on so many levels. And yes, oxytocin is a social one. It's our
yeah.
feel good factor
Yeah.
in social situations. So that was one of the reasons I went to those two hormones because I felt they were quite relevant and yeah, and very interesting to think that just with those little bits of interaction, you can you can change
Mm.
people, you know, quite easily.
fabulous. That was absolute. Thank you so much for that, Fiona. Really, really enjoyed that. That was. I'm going to ask. I'm going to ask.
Yes.
It's not a question. It's a request.
Okay.
Um, the saying at the beginning,
Yeah.
the quote
Yeah.
that you gave, I thought was wonderful. Can you post that in the chat group?
Yes. Yeah.
Because I just think that's a wonderful
Mm.
thing, and even then when people watch it back, it's there, and because I just, yeah, I just thought that was wonderful. It's actually going to appear be on the bottom of this piece of paper here, because I really liked it. But that'd be amazing.
Yep. No,
Fabulous. Oh,
cool.
thank you
More
so
than happy.
much. Thank you so much. Um, where are we at?
Just heaving a sigh of relief now.
Yeah, you did amazing. Oh,
You
Sally's
did.
waving again.
No, it's all right. I've had Bowen Technique, but
Oh, okay.
on a well, um, I can't think what her name is. Sky did it with us, but it was like our women's networking group, and because there was about eight of us, and you were talking about the gaps in between
Mm.
each movement. So basically, she would do one movement with all of us. She'd go round us all, and then by the time she got to the end one, it was kind of time to
Yeah.
do the next one.
Yeah.
So she said doing it as a group is really good
Mm.
because you don't really have to stop, but you're not doing, something to the same person.
Did you have any
You're still
reactions
doing.
to it?
Do you know? I can't remember. I'm
Mm.
sure I did.
Mm.
I'm quite fond of holistic therapies and alternatives and things like that. Well, I do Reiki myself, and I do. I've had reflexology lots in many years ago. Um, I I just think that if you believe that something is going to work, it helps.
Mm.
But there are people out there that won't even try it because they go, "Oh well, it won't work." But
Mm.
they've never tried it. They don't know what it's all about. And actually, if all it does is calm you down and make you feel better, nicer,
It's a bonus.
it's
Yeah.
job done, isn't it? It's like doing, I often find that doing Reiki on myself, if I wake up in the middle of the night, that's often the time I'll do it. Because in doing that process, doing all your symbols and things, you kind of, it calms you down. And then I drop off really quickly after that,
Mm.
where I might have stayed awake for 2 hours.
I wish there was more research. I did look into some of the
Mm,
distance healing stuff because there's clearly something that goes on in the therapeutic alliance more than we understand, and that's
Yeah,
one of the things that David Butler was raising. It's just so hard to look into, but he feels it's something that needs looking into because there's another level in the communication that
yeah,
goes on.
yeah.
Yes, of course, listening to people is important, but is there something else that's going on here when you interact that closely with somebody who has problems, and your full attention is on them, trying to help them. It'd be interesting to see if
Mm.
anything comes,
I
into
I
light
think
out of that.
it's quite like when you learn first aid training. I did lots of first aid training years and years and years ago, and they always, well, a good first aid trainer will always tell you that it doesn't matter if you don't do anything,
Mm.
but if you sit and talk to the person and keep them calm,
Yeah.
that will do more good than anything else. And you can sit and talk absolute drivel to people. It doesn't matter because it keeps them calm. It makes them feel connected, as
Yeah.
you already said.
Yeah.
And I have to say, I'm exactly the same. When I had my cataracts done, I was really nervous. The surgeon talked to me throughout the whole thing, talked about his family, about gardening, cooking, you name it. He talked absolute drivel, really. And then there was a delightful male nurse sitting on my right hand side, stroking my hand all the way through. You know. But those, again, human contact
Yeah.
and the fact that they're concentrating on you and their intent is what it
Yeah.
is, and it all, I think it all, everything connects, I think,
Yeah.
really.
Yes, I
Yeah.
agree. It's just we just don't have any sort of real validation of it, or
Mm,
somebody who can draw all of these things together and see if they can come up with some, more in-depth view
Mm.
of what's going on. But certainly, the more years I went by, the more I felt uh, it was very important how I was with the
Mm.
patient,
Yeah.
rather than in my early years when I was, trying to refine techniques and thought, oh, yes, this one worked well, and and then you think, but it didn't work with that person, and then you go on this journey, always trying to improve on what you're doing. But I came to different conclusions over the years. So yes, fascinating.
it's the same when you teach, though. I'm sure Rob will bear me out on this. You each group of students that I get, they're all different,
Mm.
and they don't work the same as another group that I've got. I've got one group that I've had for about 4 years, and I've got another group which I've had for three, and then I've got two groups that are new and things like that, and they all work their own little way, and the
Yeah.
dynamic is. The kingpin is me, but their dynamic is different, and it's lovely because, like you say, you have to treat each group as they come, and what they present with.
Yeah. No, completely. And going back, even back to like the 40s and 50s, like Carl Rogers, and a large part of his approach to counseling was he realized the importance of how we present and how we meet and how our attitude towards whether it's the group or the individual.
Mm,
Um, and that is vitally important. Um, and I guess also kind of listening to this, it gives me that thing of that real East-West divide, because in the West we go, oh, all this energy stuff, all this kind of alternative stuff, we've got no real evidence of it. There's no real proof of it. And in the East, it's like, well, we've been using this stuff for several thousand years, and we've written about it for several thousands of years. And what more of a study do you need? Here's 7,000 years worth of stuff to your boots. And so, that is one of the shames of the West, is that I think we've got too tied up in, if you can't if you can't go, here it is.
Yeah.
We
Well,
don't want to know.
acupuncture was interesting for the same reason. I think,
Mm,
had life not taken the twists and turns it did, I may well have qualified as a
yeah,
acupuncturist. But it was fascinating. Absolutely. I mean, the,
yeah,
the history of it, I knew a really, really knowledgeable acupuncturist, and the whole history of acupuncture, and what he went into. And I thought, oh yes, I could see I would
yeah,
enjoy doing that. Um, but yes, and it worked, and it
mm,
worked for patients.
yeah,
Not necessarily the nicest technique to do with the needles. But it's, you get used to it.
yeah,
But it's very, very
yeah.
interesting,
yeah,
and I'm glad I had that experience too, of at least
mm,
learning some basic acupuncture.
yeah. I did an introduction to homeopathy years ago. I was in my early 20s when I did that. Dragged my mom along to it. She was like, "What?" By the end of it, she was like, "This is great." Um, but again, that's mean, is it still there? There was a homeopathy hospital in London at one point. I
Oh,
don't know if it's still there. Um, but that comes and goes as far as one minute people are going, yes, no, it's whatever. I can just go sometimes. So you can just go off your experience of something, can't you? Because yeah, on paper I'll go, yeah, if you distill the essence of something down that many times, there's not going to be anything of it left. But something's happening because um what was it? It was back when I was living in Newport, and I'd not long finished this course. I'd been in hospital for an operation and was just a bit after it. Um, but that wasn't why I went originally. My partner at the time went for something, and doctors weren't being much use. So I said, well, let's go and speak to the lady that did the homeopathy course because she wasn't far off. But she doesn't live, well, she used to live not too far from here. And a lovely little lady called Rose, bless her, she was amazing. And so we went to see her, and I can't remember what she gave Lou. Lou was the girl I was with at the time. I can't remember what she gave her. And she said, "Oh, how are you doing?" I said, "I'm all right, but I had this operation." I said, "It's taking a bit of a time to recover." Um, and I'd grown. It wasn't anything serious. I can't. It was like a boily, lumpy thing. Um, and so she, as well as she saw, basically saw both of us in that session. And she gave me just arnica for the general recovery from the operation. And that was again the hypnotist in me goes, well, it could just be psychosomatic or placebo. But hey, do you know what? At the end of the day, if it works, who gives a damn? Um, so I started to recover a lot quicker and feel stronger and better in myself and less wobbly after it. Um, and after a couple of 3 days of taking the whatever little thingies it was, the boily lumpy thing just went. And again, there's a history of wart charming and stuff. So is it again? Could it be? So I don't know. But when it's yeah, it's it's
It's
frustrating.
there you
fascinating
go.
stuff.
It's fascinating
There you
and
go, Ross.
frustrating. What's this? Royal London Hospital for Integrated Medicine. There you go. Yeah, yeah,
I just put in homeopathy hospital and that's what it's come up with.
yeah. I thought there was
Mm,
kind of.
yeah.
I knew there had been. It's nice to know that it's still there. Fabulous. Do you know what?
It's got you out of it, isn't it?
That's our time. That's our time. What a wonderful. I like the fact I've just been able to sit back and then enjoy the chat afterwards. It makes a change. So anyone else that wants to do a talk? No, no, it's that. Thank you so much for that, Fiona. That's been a really wonderful. I'm not. I'm yeah. I'm gonna. I'm actually. I'm gonna stop the recording because I just